prise un peu plus, oui, par la Croix-Rouge pour venir en aide aux populations des pays en proie à l'épidémie d'Ebola.
Chair, Your Excellencies, thank you very much for allowing me to speak on behalf of the International Federation of Red Cross and Red Crescent Societies. My name is Leon Prop, Director of the office here in Brussels. We have been involved in responding to the Ebola crisis since March this year, and we're working not only in the countries most affected, but also in 11 countries in the wider region. We work through the national societies of the countries affected. They are auxiliaries to their government, and they have mobilized their staff, more than 4,000 volunteers. We've also mobilized international staff from more than 24 countries, 153 people in total, and mobilizing more as we speak. Our operational priorities have not changed. They're very much aligned with the strategy described by WHO, and it's based on 5 main pillars. The first one is around community engagement and social mobilization. I know that my colleague from UNICEF will speak more about that. What I want to say here is that for us it's important that it's not only key to get the correct information out through mass media, but it's actually important to listen to people. We see a lot of the fear, of the rumors, of the misinformation, and to fight that you need to enter in the conversation. So far we've carried out 2.6 million door-to-door visits, really engaging with the community. Our second point is around contact tracing and surveillance, reaching more than 40,000 people and following them up so far. I'll say a bit more about the third one, which is around safe and dignified burials and disinfection. That's of a significant scope. We have so far managed the safe burial of more than 3,100 victims and disinfected more than 16,000 houses. That's highly sensitive work. It's not easy. It's done by specialized staff and trained volunteers, and it's critical to stall the progress of the disease. As we all know, dead bodies are much more infectious than live patients. The fourth area is around psychosocial support to family members that are affected. And last but not least, we are also involved in treatment and case management. At the request of the government of Sierra Leone, we have set up a 60-bed center in Kinema, which is now operational, and we're at very advanced planning stages and close to opening another 50-bed hospital in Macenta, and further support is also being planned. Beyond the medical response, we also believe it's important to look at the wider issue of recovery. A lot of people have lost not only the loved ones, but people that actually generate an income. They're now struggling to make a living. We see that the impact is also impeding the access of thousands of people to the normal health care and other essential services, and the livelihoods of millions of people is at risk. So that also forces people to move from districts or across districts and countries, and that makes containment even more difficult. We're concerned about the security and safety of personnel, and we will keep working to make sure that our own staff and volunteers are properly equipped and follow the protocols. We're also happy to see movement and progress that has been made on the key issue of medical evacuation, which until now has actually hampered a more rapid and effective deployment. We are mobilizing support, and we've asked all our members of the Red Cross family to help us with that, not only look at financial resources, but also human resources. And in countries around the world, including here in Europe and here in Belgium, we're actually recruiting medical experts to work through us for short missions. Let me then come to some points that are important to us, a call to action, if you like. First of all, we believe it's important that all the countries at risk should have preparedness plans, and certainly the success in containing the epidemic in Nigeria is very encouraging in that regard. And we are ready to work with governments, working as auxiliaries, to help them with Ebola disaster risk reduction. And we're doing so already in 11 countries outside the ones affected. We think it's important that new actors in the affected countries are culturally sensitive, especially in the tense environment and the strong stigma surrounding Ebola. And we've been on the forefront since the onset of the crisis, and we'll be ready to share some best practice and lessons learned. We think it's important to coordinate to limit the shortages of supplies. We see now with a multiplicity of actors some additional stress, for instance, around the availability of body bags and so on. That requires effective coordination. Last but not least, we think it's important to sustain the quality of care, especially as we are moving to smaller community care centres. We are appreciative of those efforts to scaling up the treatment, but we should then make sure that we have trained medical personnel in as many centres as possible, or for mobile teams to provide effective supervision. That would also reduce the risk that those community care centres could actually become further epicenters of transmission. In summing up, this is a very complicated multidimensional crisis. We think that the epidemic is still outpacing the response, and we need to scale up further our collective response. We need culturally sensitive approaches to address ignorance, denial and stigma, both in the countries and communities affected and worldwide. And we need to scale up our preparedness in risk countries. Thank you.